The Student Athlete handout provides tailored information for students. The handout includes 3 pages of information and a reference page for further reading. Page 1 talks about the risks of taking opioid pain relievers. Certain pain relievers that are prescribed after an injury or surgery are dangerous if you do not use them correctly, especially opioid pain relievers. Prescription opioid pain relievers have many names, like oxycodone, codeine, morphine, and hydrocodone. What do you need to know about opioid pain relievers? 1. Opioids are highly addictive. 2. Opioids can cause overdose. 3. Depression and anxiety disorders can increase the risks of addiction and overdose. 4. Opioids may cause unpleasant side effects such as feeling tired, sad mood, nausea, constipation, dizziness, and mental confusion. And 5. Opioids are not the best or only option for pain relief. Since opioid pain relievers can be misused, they should be stored in a safe place and leftover pills should be discarded. Page 2 discusses how student athletes are especially at risk of misusing opioids. 90% of student athletes report some type of sports-related injury. Due to the increased likelihood of being injured, those who participate in interscholastic sports may be particularly vulnerable to engaging in opioid misuse or developing an opioid use disorder. Some pain management methods that might be useful include the RICE method, which stands for rest, ice, compression, and elevation for at least 48 hours immediately after an injury. Use over-the-counter pain relievers conservatively to help control pain and reduce inflammation. And ask your health provider for additional treatment methods like immobilization, cold or heat therapy, ultrasound, or massage. Your physician may prescribe opioid pain relievers to help you control pain caused by a serious injury. CDC guidelines state that 3 days or less of opioid medication is typically the most you'll need to manage acute pain. If your physician prescribes you opioid pain relievers, ask these questions. Why do I need to take this medication? How many should I take and how often? What side effects could I experience? What activities should I avoid while taking this medication? Can I stop taking the medication at any time? What should I do with leftover pills? Can I alternate my opioid medication with over-the-counter medications? And are there non-opioid alternatives that could help with pain relief? It is important to let your physician know if you or someone in your family has struggled with substance use, you are taking other medications or supplements, or if you use drugs or alcohol. This may cause an interaction with pain medication and can result in serious health consequences. Here are some of the tips the toolkit provides for student athletes. Stop any activity that is causing pain and talk to a professional. Seek medical treatment if there's persistent or severe pain, swelling, or numbness. Follow up with a specialist after a sports-related injury and don't be afraid to seek a second opinion. And be as informed as possible about your treatment plan and pain management options. As you face recovery from a sports-related injury, it is important to attend to your emotional well-being, use accommodations and support to help keep up with schoolwork, return to play safely and create a return-to-play plan with your parents or guardians, medical team, coaches, and trainer, and learn to prevent injuries before they happen. To learn more about the other parts of the toolkit, please click here for additional video tours.